Second Opinion is brought to you by Blue Cross Blue Shield. Accepted in all 50 states. Blue Cross Blue Shield. Live fearless.
Second Opinion is produced in conjunction with UR Medicine, part of University of Rochester Medical Center, Rochester, New York.
CPR in America was produced in collaboration with the American Heart Association.
This is a Second Opinion special edition, CPR in America. 9 out of 10 cardiac arrests that happen outside the hospital end in death. And yet, most people are afraid to act if they see someone in trouble. Well, we're going to change that. We're going to do something that's never been done on national television before. We're going to teach you how to do hands-only CPR. You're going to meet people who survived cardiac arrest and the people who saved them. And we'll talk with celebrities about CPR. I'm Dr. Peter Salgo. Spend an hour with us and save a life as we teach all of America CPR next.
Knowing CPR can literally be the determining factor of whether somebody lives or dies. If you think about it for a minute, you will more than likely experience a cardiovascular event in your home or at your office or somewhere around people that you know and you love. Wouldn't you want to be able to help save their lives?
We've interviewed a lot of people. I've seen a lot of people come into my hospital. They all talk about the terror of the moment, which is, oh my gosh, that's my dad, that's my mom, it's my child, and I've got to do something. I'm scared out of my wits. But if I don't do something, they're going to die. How do you get through that?
70% of people in America feel helpless when they see someone having a cardiovascular event. You're not as helpless as you think you are if you're trained. We can train you to do hands-only CPR. We can train you to do the more advanced CPR, but you might be a person's last resort. And think about that if it's somebody that you love. Wouldn't you want to be forearmed? I'm forewarning you. You can forearm yourself.
That's a good question. Wouldn't you want to be forearmed? Yes, you would. All right. What a great crowd. I want to thank you all so much for being here. Thanks for watching today, you at home. We're going to teach you hands-only CPR, which is an important link in the chain of survival. Now, here to teach us is American Heart Association trained CPR instructor, Annette Adamczak. Let's hear it for Annette. Way to go. The chain of survival is a 5-step process to provide treatment to victims of sudden cardiac arrest. The first link is all about knowing what to do when an emergency happens. Here's American Heart Association Dr. Fiona Banji.
The first link in the chain of survival is to immediately recognize a potential cardiac arrest and activate the emergency medical system by calling 911.
Annette is already at work teaching people how to recognize the signs of cardiac arrest and how to make a good call to 911. That's exactly what 2 young women did when their mother needed them the most. She wouldn't be here today without their quick response during a very scary situation.
I was scared to death. And the only way that I felt to save her, the first thing that came to my mind is give her CPR.
All I could do was think of, we have to save her. She's all we have. She can't go now. She can't leave me now.
My oldest daughter would tell you now she never thought ever she had to use CPR. Pretty amazing story. My daughter's is very amazing.
She always keep herself uplifted, happy. She's a happy person.
Carolyn, if I could come up with a word to describe her, I would say probably vibrant. She's lovely. She's got a perpetual smile on her face, and she warms whatever room she enters.
She's like the hero, our superhero, Supermom. She does it all.
It started out, I was having chest pains, pains up and down my arms. About 3 times we went to the doctor and never diagnosed that I was having a heart attack. I did an EKG. Went home, laid down. My daughter told me she knew something was wrong because the next day I didn't get up and clean up anything.
I knew something was strange because she wasn't there at all downstairs.
That night, the last thing I remember, I went back in my room and I was in a sitting position, like finna sit down on the side of the bed, and that's when I had it, the heart attack.
I heard a big boom. I hit the floor. That I could tell that didn't have no life in it. And then I began to hear my sister scream. So I jumped up and I go in there and my mother is laying face down.
When I fell face down. And I'm a tall woman. And she would tell you with the God's strength and grace of God, she had to turn me over by herself to do CPR. She knew it was a heart attack. She knew. And she went to work.
So I told my sister to call 911. And I began to work and do CPR. My mother taught me CPR like 12 years prior to that. And I had never performed CPR. But that night I began to pray as I was doing it. And then my mother began to start making like a hissing sound of breathing. And then I felt like a faint pause. But I was telling her to stay with me. And within 2 minutes, I turn and I look and I see the fire department standing there inside of the room with me. And I began to continue to pray and I moved out the way and they brought her out. And when they got to the porch, she flatlined again. So they had to work on her again on the porch. They got her stable again and they moved her.
So I met Carolyn in the intensive care unit, and at that point, she was a few hours from her cardiac arrest. So she was in a coma and attached to life support measures. So we know from studies that if you can lower someone's core body temperature, they have a better chance of surviving the event, and they have a better chance of meaningful survival down the road. So you have a few hours after the event occurs to implement something called the Arctic Sun, which is therapeutic hypothermia, or us lowering her body temperature for the purpose of preserving her brain function.
Dr. Angelo Padula is awesome. He's my hero.
At the time my mom had a heart attack, I was 15 years old at 10th grade. And she always said, I want to be there to see you graduate. I'm going to be there to see you graduate.
She started exhibiting, signs that she was going to do well. She was waking up, she was following commands. She wasn't quite herself in speaking with her daughters, but she was improving, vast amounts each day.
It was the best thing ever to witness. Seeing my mom back up, talking, being able to look at me, feel me.
Our life was given back to us, not just hers.
So you're going to be scared. I've been doing this for about 10 years, and whenever you're in a room and somebody has a cardiac arrest, the first instinct is always, oh my God, this is terrible. But you have to do something to overcome that. You have to act. And CPR is the best thing that you can do, because we know from studies that early CPR done by bystanders, not trained medical professionals, is one of the most important, if not the most important intervention to save someone's life. And chances are that life that you're going to save is a loved one. If her daughter didn't overcome this tremendous fear when she sees her mother go down and start CPR, we wouldn't be having this discussion.
I'm alive today because my daughter did CPR. And she saved my life.
CPR is something that everyone should be able to do. You never know when you will have to perform that on someone.
You got kids? Teach them CPR. It'll save your life one day, you never know. Or your neighbor, your friend, your grandmother. You never know.
Oh my goodness. This is Carolyn. She's right here with us. Your two daughters. You got family behind you too?
Yeah.
You stand up. It's amazing. God bless you. You're here. What an amazing, amazing story. When you think back on it, what do you think about most?
That I never would be in that predicament. I never thought that would happen to me.
But it did.
Yes. I was always strong, took care of others. Never had to be taken care of. But pretty scary.
Very scary. Was it scary for you? You did CPR and your mom?
It was very scary, but I knew I had to do something to save her.
How did you summon that courage to do that?
I felt like it was in my heart. It was like an inner me telling me that I had to do something to save her. I didn't have time to panic.
You're a hero.
Thank you.
Give a hand for everybody here. This is amazing. One of the things I love as being a doctor is seeing people who've survived. It's just insane. Somebody's here for you.
That is my doctor. That's my angel.
Dr. Padilla, thank you so much for joining us. Way to surprise a client who's had a heart attack. Can I talk to you for a second professionally here? Sure. I want to ask one really critical question. Now, you had a heart attack and you had a cardiac arrest, but they're not the same thing, are they?
They're not. And if you're not in healthcare, you may get them confused because there is some overlap. So what a cardiac arrest refers to is the sudden collapse of the heart's function. So the heart just stops. And it usually stops from a rhythm problem, either being too fast, too slow, or not beating at all.
So you can have a cardiac arrest and not have a heart attack. You can have a heart attack and not have a cardiac arrest. But we're talking about today is cardiac arrest and CPR.
Exactly. Cardiac arrest, the electrical instability. The heart stops beating because the electrical impulses are off. And there is overlap. About 2/3 of the time, that impulse is off because of a blocked artery, which is what we think of a heart attack is.
All right. Well, thank you so much for coming. You like the flowers?
Yes, I love them.
Way to go. Thank you so much for being here. Thank you all. Carol and Shanika and Abresha, Dr. Padilla, thank you so much for being here, sharing your story. And now it's time to learn the first link in the chain of survival. Are you ready, Annette? Let's get going. Let's do this thing. All right.
Good job.
What are we going to do?
Okay, the first thing we need to do when we see a potential victim is we need to make sure that the scene is safe, that there isn't anything that can hurt you.
Like an electrical wire, a cable that might electrocute
Absolutely.
you too.
Because if you touch him and he's still got that electrical line in his hands,
Okay.
you're going to get electrocuted.
Okay, so then what? We assume that this
You
is safe?
make sure
We
it's
ascertain
safe. The next step that you're going to do is put your hands on their shoulders. You're going to check for responsiveness. Give
How do
him
I
a
do that?
good hearty tap and shout, "Hey, are you okay?"
Hey, are you okay?
Good.
Sounds a little silly, but it's important.
Absolutely. You want to make sure that he's not just sleeping.
Okay.
Your next step in the chain of survival, if he doesn't respond, is to go and get some help.
Okay. Now, if you're not alone, you can ask someone, do you know CPR?
Absolutely. So you can turn around and ask someone, "Hey, can you call 911? Can you
Okay.
get me an AED? And if you know CPR, come and help me."
I'm going to give my cell phone to Sasha, who's right here. She can call 911, put it on speakerphone.
Absolutely. And if
Okay.
you're by yourself, don't hesitate to be afraid, because that 911 operator is there to help you. It's a trained professional on the other end of the line.
And
So if
he or
someone-
she's got a script.
If someone's alone, then everything should be okay.
You should be all right, because they're there to help you if you have any questions along the way.
Okay. Now what?
Your next step is to turn around after you've checked for responsiveness. You want to see if they have normal signs of breathing. So you're going to put your head near the victim's mouth and scan across his chest. You're looking for a repetitive up and down motion. You look for no more than 10 seconds.
And I guess you're looking for what? Normal breathing motion?
Normal breathing motion, a normal rise and fall of the chest.
I think most people know what normal looks like. Anything that gives you any concern at all?
Anything that doesn't look normal, you go ahead and you still do CPR. When
Okay.
in doubt, push it out.
So that's it. That's how you
it.
determine what to do. That's how you do the first step.
Absolutely.
So should we go over this again?
Right from the top, the first thing you need to do is make sure the scene is safe.
Okay.
The second step is to check for responsiveness. Come on, everybody, tap and shout.
Are you okay?
If he doesn't respond, go call 911, go get me an AED, and now you're going to check for breathing.
And make sure that there's someone maybe if can help you who knows CPR out there?
Absolutely.
Okay.
Get them involved. Look for no more than 10 seconds. If you don't see a normal rise and fall of the chest, you're going right into CPR.
Okay, straightforward. That's the first link in the chain of survival.
Absolutely.
That's great. It's easy enough to do if you keep your wits about you, huh?
Absolutely.
All right, now you know the first link in the chain of survival. Recognize a cardiac emergency. Call 911. Now it's time to learn the next link, hands-only CPR. But first, another thought from Star Jones. I spoke with her last week.
The first thing you want to do is you want to recognize that a cardiovascular event is occurring. You want to know some of the symptoms. And female symptoms can be different than male symptoms. You also want to be able to ask the person questions if possible. You want to use all of your resources, and then you want to make sure that there's a follow-up so that you have the protocol for getting them to real emergent care.
That's a chain of survival of which CPR is part.
Absolutely, but it's a very vital part because CPR can save lives.
And now it's time to learn the second link in the chain of survival.
The second link in the chain of survival is life-saving. It's chest compressions. Put your hands together, put them in the center of the chest, push hard and push fast.
We can't emphasize enough the importance of beginning CPR quickly. In fact, it's a matter of life and death. And that's what a mother and father discovered when they checked on their sleeping child.
On March 26, 2008, somewhere around 7 a.m., I got out of work a little early and I was coming up the driveway, and my younger son Zachary saw me and got a little excited and opened our door. And what that did is triggered our alarm to go off. Came in the house, reset the alarm, and we had just bought a travel trailer, and Becky and I were in the bedroom discussing picking it up. It was snowing out, she didn't want me to get it, and it dawned on us that we did not hear from Cameron. So I went in his bedroom and found him dead in bed.
He was on his side and he was blue. So he had, from all my knowledge from nursing, EMT, I knew he was gone, and I knew he was gone. He had been down for quite a while. So I got him off of the bed and put him on the floor, and I just started CPR. Gave him mouth to mouth and continued to do that until the fire department arrived.
They came in the house and Becky was in Cameron's bedroom, and we actually, all four of us for a little while, worked him. And then the ambulance showed up, which was, we're talking with all in a few minutes, nothing extraordinarily. It felt like hours, but it was literally just a few minutes.
The whole time while I'm doing CPR, I'm also thinking, what's going on? What caused this? So when the fire department got there, they initially shocked him, brought in the defibrillators, and it was two people actually that my husband was working with and worked with on a regular basis. So it was very difficult for them too. We ended up taking him to Unity, where he arrested a couple more times. In ED, they kept asking us a bunch of questions. Did he take anything? Had he been sick the night before? And, I just sat there by his side the whole time and said, he's a normal, healthy boy. There's nothing wrong with him.
The call about Cameron came in to our transport team from an outside hospital where he had presented after his arrest at home. The prognosis would probably be described as guarded because even though at that point that he was stable, meaning that he had a regular heartbeat, a normal heart rhythm, but just by virtue of having had the arrest, knowing that he had a period of time without a normal heartbeat, primarily the concern is that he may have suffered some brain injury. And so we had no way of knowing when we first saw him what his outcome would be.
And then putting the timetable together after the doctors kept asking us questions, what time did the burglar alarm went off? What happened? The whole situation, and going through, they discovered that it sounds like he had long QT syndrome. And based on the EKG, the QT was elongated severely. And so they put him in the medically induced coma, and we had to wait it out.
Cameron does have long QT syndrome, which is a disorder of the heart that puts people at risk for sudden cardiac arrest and sudden death. The science at the time supported actually cooling people, making their brain and their body temperature cooler than normal in the hopes that that would improve their neurologic recovery by decreasing the demands, decreasing the metabolism. But that meant that we were completely supporting him. So the ventilator, the breathing machine was doing all the work for him. And then once that cooling protocol was complete, we slowly let the body warm up to a normal temperature.
They decreased the medications to sedate him, and so they started asking him questions.
And then the primary thing we look at is what kind of movements they have, and then very specifically whether they can start to understand us when we ask them to do things, to obey commands. It's always with some, anxiety whether that's going to happen or not, and if it doesn't happen initially, that maybe it will with time, but you also know that sometimes that's not going to happen.
I think it was the first one was, is your name Cameron? And there was really nothing. And then I started talking to him about the Red Sox, because Red Sox are his favorite team. And so they said, do you like the Yankees? And his response was, immediately his eyes kind of opened, and he didn't blink. He had a tube in his mouth, he was still being ventilated, and he just went like this.
Neither one of us really slept for probably 3 weeks, to be honest with you. And I'd gone upstairs to take a shower, and I come back down, and she's out in the hallway crying. And what Becky was crying about isn't that there was a problem, it was tears of joy knowing that it looked like we had our son back.
And so then they decided at that point, we're gonna take the tube out, and we're gonna see how he does, if he can breathe on his own, if he can function. And so they ended up taking the breathing tube out, and he said his first words. So that right there, we knew that all that we have done, the CPR, doing all that, it was for a reason, and it had a purpose, and it saved his life.
My message for people would be that there's absolutely no doubt that what makes a difference is the care that patients receive in those first seconds and minutes. It's the people with the patient, it's their family, it's bystanders, and that they can make a real difference. And if they have the training, then the muscle memory kicks in. You do what you have to do, you deliver the CPR, and you too may someday find yourself in the position of saving someone's life.
Stand up, would you please? That's the family. Mom, Cameron, good to see you. I'm glad you're here. Dad, Zach, right? Good to see you. We've also got Kevin, right? Kevin was one of the responders who helped do the CPR. That's just amazing. I got to just talk to Cameron for a second. Excuse me. I'm a Yankee fan. But for this day, I'm a Red Sox fan.
There you go.
All right. But I'm not giving you more than one day. That's a terrible, terrible moment. I don't know, whether you must still think about it.
Oh yeah, we think about it every day.
But from that moment, you created something. What have you done?
Well, after that moment, we knew that we needed to do something for our community, and we needed to do something for other kids and the community to learn CPR and AED. So we went to our local school in Greece, New York, and we went to the district, and we asked them to start CPR and AED training for all our students. And with the help of our EMS and American Heart Association, we accomplished that goal and trained 6,000 kids and teachers CPR.
Oh my goodness. Now, absolutely. There is something in the CPR community known as the ripple effect.
Yep.
So you got this into the schools.
Yep.
The schools started teaching this.
Yep.
And then one day here in Rochester, New York, at the Red Wings ballpark, AAA team, right?
Yep.
Not a bad ballpark or...
Not bad.
Oh,
Not
cut it out.
bad.
They're not the Red Sox, but they're just fine.
They're not the Red Sox, but it's okay.
But somebody had a cardiac arrest in the parking lot.
That's correct.
And you did something, right? Stand up and join us. And you're the principal. Your name is?
James Palermo. I'm a principal in Greece, New York, and I received the training, CPR training, after you and your family came and presented to the board and got everybody on board. Yep.
So you were at the ballpark. What happened?
Well, we were in the ballpark leaving the game, and in the parking lot afterwards, somebody came running and said that somebody was in cardiac arrest, and myself, along with a number of other people here.
Stand up and take a well-deserved bow and round of applause.
We all ran and we gave CPR, and then pretty soon, the paramedics, and with the help of the amazing paramedics, they were able to revive him, and he is doing well today because of it.
That's just great. That's just the whole point of this show, isn't it? You know, at the ballpark, you got to wave. We got to wave too. It's a ripple of CPR and a ripple of life. You can't hardly get better than that, can you?
No, you can't.
So from something terrible, something good. Amazing story. Amazing ripple effect. That's what CPR training is all about. In deference to you, Cameron, we'll call it a wave, like in Fenway Park. But I got more for you to do. The grown-ups can all sit down, except Zach, you can sit down too. Cameron, you know how to do CPR. You've taught CPR. We're going to put you into service. Come with me. All right. It's time to do some hands-only CPR chest compressions.
Absolutely.
What do I do here, teacher?
Well, the first thing, we've already covered that first link in the chain of survival, so now we're going to do compressions. And it's important where you place your hands. You're going to put your hands in the lower half of the sternum, center of the chest. You're going to get all the way up, lock your fingers, lock your elbows, bring your shoulders over the top, push down at least 2 inches, and push at least 100 to 120 beats per minute.
How do I know that? How do I know how fast that is?
Kind of like the song Staying Alive by the Bee Gees. Are you ready?
I'm ready. Here it is.
Let's go. Push. Push them all the way deep until you see those 2 green lights and you hear a clicking sound.
I'm not the only one hearing this music, am I?
I hope not.
Oh, goodness.
Now, each time you push down, you're actually squeezing the heart between the ribs and the spine, and you're forcing the blood to circulate throughout the body. By allowing the chest to fully recoil or to come all the way back up, you're giving that heart a chance to fill back up with blood, so the next time you push down, you've got more blood to circulate.
Got it.
So how come we're not doing mouth to mouth?
You don't have to. In the average adult, this method of CPR can actually sustain life until help can arrive.
That's great.
And again, hands-only CPR is only effective on adults and teenagers. It does not work on infants and children.
There is CPR for them, right? But you've got to get
full certification on it.
Right. When can I stop doing this?
The only time you stop is when further advanced medical care takes over. Because every time you stop, it takes 6 to 8 compressions to get that blood flow started all over again.
Okay, so what you did was not good.
That is not good. You keep going.
I don't know, I feel like I'm going to hurt someone. Is it too hard?
No, you know what? If you break a bone, that's okay. Because when we're at the hospital, we can actually fix a broken rib. But if you don't get to the hospital, it doesn't matter if you broke a rib or not.
This is life and death.
It is life and death.
All right, what I want to do now is stop and reset, because I want to review it once more for everybody.
From the top.
Let's take it from the top of the chest compression.
Absolutely. First thing you do in the chain of survival is you make sure the scene is safe. The second step, everyone, you remember how to tap and shout? Show me.
Okay.
Are you all right? Good. If he doesn't respond, our next step is to tell someone to go call 911, go get me that AED.
Okay.
After that, we're going to turn around and take no more than 10 seconds and look for signs of life. You put your head near the victim's mouth and watch for that normal rise and fall of the chest, which would indicate he is breathing.
Okay.
If you don't see that, that's when you go into compressions.
Okay.
Hand placement again, all the way up on your knees. Are you ready?
I'm ready.
Push hard and fast. One time, let's go.
All right, and you don't stop.
You don't stop, you keep going until help arrives.
Supposing you get tired, you don't think you can keep going?
If you get tired, you keep pushing on, because the minute you stop, this person's chance of survival is down to zip.
Goes down to zip. Straightforward. This is a full contact sport, isn't it?
Yep, it's not for the faint of heart. No pun intended.
I
Let's
hope
go.
you wouldn't say that. All right, I'm not going to stop doing chest compressions because you can't. But I am going to tell you that now you know the second link in the chain of survival. You start chest compressions, hands only, CPR. Quickly, you push hard and fast in the center of the chest. You use the tune Staying Alive as your guide to your compression rate. Now in a moment, the third link of the chain of survival, we're going to show you how to use AED. So let me ask you this. You didn't have a heart attack. You had heart surgery. You had heart disease. God forbid.
Yes.
You actually had a heart attack. You had a cardiac arrest. What do you think, given the state of preparedness in America today, would you have survived?
I'm not sure that the people around me would have been prepared to do CPR. As I think about when I first started experiencing very serious symptoms, I was in the Dominican Republic. I was with friends. None of them know CPR. So I don't know if I would have been a statistic. It leaves me with a cold feeling, but I can tell you now, if somebody were to experience a cardiovascular event around me, I'd at least be able to do something.
Now it's time to learn the third link in the chain of survival. It uses a machine that can shock a heart that has stopped back into life. You'll find AEDs these days in all sorts of places, in malls and schools and offices. The AED is no longer just for paramedics and doctors, it's for you to use as well. And here's Dr. Banji.
The third link in the chain of survival is early defibrillation through the use of an automated external defibrillator, or an AED. Don't forget to continue chest compressions until the AED is ready for use.
Use of the AED is an important link. Now remember, when bystanders take action by recognizing an emergency, calling 911, beginning CPR, they can triple a victim's chance of survival. Our next story involves someone you already know.
We had 4 children, all 2 years apart, always interacting with each other. They loved to play outside. They were your typical kids. They loved to get into the dirt. They loved to play. And they were pretty close growing up. You know, they relied on each other. You know, they stood up for each other.
Emily was the closest child to me. We were exactly 2 years apart. She was the most bubbly person you'd ever meet. No matter where she went, she was making friends.
Emily, as a child, was very energetic, very much like a burst of sunshine. She always had a smile on her face, was very much a bubbly personality. When she started going into her 9th grade year, she started having syncope episodes, which is where she would just pass out unannounced. Most of the time it was during exercise. So we took her to go see a cardiologist. They ran through a whole series of tests. The only thing that they found is that her blood pressure was really low. So they put her on medication to raise her blood pressure. Her 9th grade year, last day of school, she was on the soccer fields at a practice, because it was for a town league. So it wasn't a school event. Emily and her then 12-year-old sister Shelby and about 25 other kids were, you know, doing a general drill. And as they came around the field, I was sitting in between 2 fields, and Emily said, "Mom, everything is going black." And that usually meant that she was going to have a syncope episode. She passed out in my arms, and that is where she took her last breath. We didn't know, and this is the thing that is so important, is that we did not know what to look for. And because she had suffered these syncope episodes before, we were told that if it happened again, just pick her up and keep her moving, she'll come right back too. And that's what we did. So we did not call 911 immediately. Emily collapsed at 7:35 at night, and at 9:05 at the local hospital, we had to sign a piece of paper that said she wasn't coming home. And then we had to come home and tell 3 kids that their sister didn't make it, that their sister suffered a cardiac arrest and was not coming home. If we can prevent that from happening to someone else by teaching them how to do CPR, then this will be worth it.
Emily made an impact no matter where she went. She's been gone for 6 years now, and her legacy is still living on. Because she passed away, we move forward trying to make sure that this doesn't have to happen to anybody else.
In 2011, I was sitting home speaking with my kids, and I found out that my children were not learning CPR in school. And I could not understand what had happened, that the schools were no longer teaching, obviously for me, such a vital, life-saving skill. So I approached the school and Principal Joe Lucenti and asked him if there was any way we could discuss bringing CPR training into the students.
When Annette first came to me with the idea for CPR training in the schools, I think my first reaction was surprise that no one had ever thought of this before. it was so refreshing to hear an idea that could impact everyone and was so necessary. As educators, everything we think about is, what do we teach kids for life, not just for that diploma? And so when Annette brought that, I think surprise was my first thought. My second thought was, what an incredible tribute to Emily, and to the fact that out of such tragedy, something so positive could come.
Since the 2012 school year up until the 2014-15 school year, we have trained almost 17,000 students.
What a feeling that this young woman's life really lives on, with the fact that people's lives can be saved by something that unfortunately wasn't done for her. It's also a reminder to us as a school that we have a family here that took tragedy and made something so positive out of it.
When a parent loses a child, they lose a piece of their heart because you carry them with you, and you know that when you miss them to the point of the only thing that helps you heal is to sit in the quiet and hear your own heartbeat and know that each time it beats that they are with you, you have to keep going forward.
Hardest part, honestly, is knowing that I have a 2-year-old who now has my sister's middle name, and knowing that she's so much like my sister, but my sister doesn't get the chance to even see that. We move forward because she was the best thing that's ever happened to this family.
I don't even know where to begin. I think I can speak for everybody here. My heart broke watching that. I don't even know what to say to you other than I know you've taken this and you've moved toward doing some good from it, as we heard in the tape. Tell me a little bit about what you've done.
Well, you know, we started with the CPR in schools. Found out that there was actually legislation to make it happen. And thankfully, New York State Board of Education agreed with us. And as of October 7th, New York State became the 26th state in this country to make sure that all their high school seniors before they graduate learn hands-only CPR.
In part due to your efforts. That's wonderful. Wonderful. By the way, I want to thank your family is here to support you too.
Yes,
They're
they
up
are.
there.
Yeah, thank you.
You know, when you think back, is it just in the schools? Can you do more? Can you do?
You know, there's raising awareness in the community is really where it is. Bystander CPR, if it gets enacted in the first 2 minutes of a witnessed cardiac arrest, you can double or triple their chances of survival. So if we better prepare the community and our children, we can turn around and make a difference in the lives of those around us.
You know, you met with our producer, and when you did that, you said something that stuck with all of us. I'm just going to read it verbatim. Quote, "We didn't know what to look for. We weren't prepared. The team was not prepared. The soccer league was not prepared. As a parent, I was not prepared for this kind of emergency." Fill that out for me. What do you mean by that?
Well, you know, you're on a soccer field. All these kids are athletes, whether they're 8, 10, 15, 20. You think that their health, the only thing that you would worry about would be a broken bone. You're not ready for this. You know, we weren't ready to see someone go down. We didn't know what to look for. We didn't know to check for responsiveness. Now, if we can teach someone what to look for so that they don't have to travel that journey, that would be worth it.
What about AEDs now?
AEDs, it's an electronic device to help that heart get back into sync and get back to that beat that it needs to do. So if you'd like, I'd love to show you how to use one.
I'm game. Let's go.
All right, let's go.
All right.
Now there's a few things. The first thing you need to do, just to remember, is that the whole time you're getting the AED ready, Okay, you're still doing CPR.
I'm not going to do that for now,
Nope.
but we're doing CPR while you're getting
Absolutely. But let's talk about the things that you can find as soon as you open this up. You'll find the pads that adhere to the chest. You'll find a prep kit where there's a pair of scissors and other things that will help you get that patient ready for the AED to be used. So if you've got the scissors, you have to remove the clothing from the chest. The pads can only adhere to the bare skin.
Okay.
So what we're going to do now is we're going to turn it on. If you put your hands in place as if you were doing CPR.
Okay.
And we're going to turn on the AED because that's the first thing you need to do when it comes on scene, is you need to turn it on. It's a portable electronic device. And it's going to talk to us and walk us all the way through.
Unit okay. Stay calm. Check responsiveness. Call for help.
Now, all of those steps we've already talked about in the chain of survival. So now we're going to get ready to attach these pads. And if you noticed, Peter kept doing CPR as we were going through.
Attach defib pads to patient's bare chest.
Okay, now lift your hands. This is when you will stop doing CPR. We will peel the adhesive backing off and stick them firmly to the chest.
Attach defib pads to patient's bare chest.
Once they are attached.
Don't touch patient. Analyzing.
Now, as it analyzes, it's looking for a viable heart rhythm. So what you want to do is you want to step back and make sure that no part of you is touching the patient.
So it won't hurt a patient because it's going to see whether or not it's safe.
Correct.
It does that itself.
Correct. You don't have to think through this. It will walk you through it and talk you through it.
So it's okay. It's safe to use it. You can't hurt somebody.
Absolutely.
Okay.
So now it's going to look for that heartbeat.
Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button.
So once it makes that noise and that button is flashing red, that's when you get ready to deliver the shock.
Don't touch patient. Press flashing shock button.
Stand clear.
Shock delivered. Start
And they
CPR.
move. And it told you immediately after the shock is delivered to go right back into CPR.
Right,
Now,
with the pads in place.
We leave the pads in place. They do not get removed until more advanced medical care takes over.
How do I know if it's worked?
Continue CPR.
You keep going. If the patient moves or exercises any kind of responsiveness, you stop doing CPR. But until that happens, you keep going. If you get tired and I'm here with the AED,
Continue CPR.
I can go back and take over for you and we can tag team it out and we can become a team of rescuers.
Okay.
So are you ready? Lift your hands and I'll take over.
Go.
And we still keep going. We don't stop. Now every 2 minutes,
CPR.
every 2 minutes it's going to reanalyze the patient and decide if they need another shock. It will continue to shock every 2 minutes until help arrives or until that person revives.
Okay, so
Continue
it's safe to
CPR.
use. It will never shock a patient and harm the patient.
Correct.
And it will check to tell you when it's safe to stop. Otherwise, you keep going.
Absolutely.
Straightforward. It's easy. Anybody can do this, not just paramedics.
Anyone can use it. It has been made user-friendly. It's easier to operate than your computer.
Most things are.
I know.
But this is pretty straightforward. The trick seems to me to be to get them everywhere.
Absolutely. We need to get them out in the community. Right now, if you go to a place called the mall, if you go to any government buildings, airports, sporting venues, they're all there. They're in schools. For crying out loud, they're at regular restaurants and some churches even have them.
All right. That's, what did I hear? Golf courses.
Absolutely.
Absolutely. I understand they're on golf carts, too.
Yes.
A really good place to be because it's a long walk to, what is it, the 9th hole all the way out.
All
or
the way
whatever it
down.
is. I don't golf. This is straightforward stuff. You listen to the machine, do what it tells you.
Follow the prompts.
All right, straightforward. You now know the third link in the chain of survival. You use an AED alongside CPR. Just turn it on, follow the instructions, and don't stop giving CPR until the AED is ready to use. In a moment, 2 more links in the chain of survival and tips for sharing what you've learned today.
Because I made a commitment to change my lifestyle and make health a part of that lifestyle, I could tell when something was wrong. I remember it was over a Christmas holiday and I was short of breath. I would get lightheaded when I would go from seated to standing. I was with a friend who said, "You have to check it out." So I show up at Mount Sinai Hospital And I'm thinking, they'll figure it out. Well, yeah, they did. I was told I had heart disease. And not just heart disease that I needed to monitor, but heart disease that required open heart surgery. Anybody that tells you that getting a diagnosis like that does not scare them, they're not telling the truth. I was frightened beyond belief. I was forced to face my own mortality. I knew that I'd have to make an additional effort to commit my life to health. I had what's called preventative open heart surgery. One of the things that is most important to me is I immediately jumped into a cardiac rehabilitation program. And for 3 months, I did a very intense rehabilitation. And that required me to really work at what I call heart boot camp. And that's what changed my life. I saved my own life by making those really important decisions. But what changed my life and gave me confidence to live again was cardiac rehabilitation. Life can be in your hands. But it starts here. It starts with you recognizing that you have the power to build healthier lives, to aid in building healthier lives. You have the power in your hands. That should fill you with a certain amount of pride and strength and power. I am the face of heart disease because I live with it. I am a heart disease survivor, and I wear that like a badge of honor.
For the last hour, you've seen how important you are to the chain of survival, the things that need to happen in order to increase a person's chance of survival in the case of cardiac arrest. The 3 links are recognize the emergency, call 911, begin hands-only CPR, and then use the AED to deliver rapid defibrillation. There are 2 more links in the chain of survival that relate to what happens after professionals arrive on the scene. And here to discuss those links is Dr. Vivek Moitra, a colleague of mine from Columbia Presbyterian and a volunteer for the American Heart Association. Now, Vivek, we see firsthand in the critical care unit the folks that come in. We don't even see the folks that don't make it. I've got to tell you, I've been in the business longer than you. The number of people that have walked away from successful CPR is nothing short of amazing. But on the other hand, the number of people who might have survived that hadn't, it breaks my heart.
It's remarkable.
What about you?
It's remarkable. I think the thing that we always learn is that so much of what we do begins out in the community and begins out in the field. And when those first few steps are successful, our job becomes much easier.
Right. So what are these other links we're talking about?
So the 4th and 5th link really focus on what healthcare providers like you and I can do to patients after a cardiac arrest. The 4th link is advanced life support. And by advanced life support, we're talking about advanced monitoring for patients, providing the appropriate medications and airway support. The 5th link emphasizes the care that we give these patients for the first 24 hours after the cardiac arrest. And by care, we're emphasizing controlling body temperature, maybe relieving some of the blockages in vessels that are supplying the heart and supporting heart and lung function.
Yeah, but of course, none of this makes any difference if they don't get to us in the first place. So the folks here have to learn what to do first.
Exactly.
Now, every 5 years, there are new CPR guidelines. In fact, 2015 is a new guideline year, right? They're coming out.
So the American Heart Association works with a large number of experts who are constantly reviewing the best published evidence in terms of resuscitation. And part of that process culminates in the production of guidelines and educational curricula every 5 years. These guidelines are produced, frankly, to advance our science and to teach us not only how to do CPR, but to do CPR better.
And I think I'm safe in saying to improve survival and make people live better.
Exactly.
And longer, right?
Exactly.
You know, just like the last 2 links in the chain of survival, the new CPR guidelines relate to healthcare professionals and the tools they use. And here are some highlights.
One of the things that we've done to develop the guidelines is look at data about what things work and what things don't work. We've taken into consideration that it's easier to implement strategies that are simpler. So I think our new guidelines have a shorter list of drugs, fewer drugs in the drug box that professionals might use during a resuscitation. And this is a conscious effort to make resuscitation as simple as possible and use those things which have the best evidence of achieving good results. So, for example, 10 years ago, there might have been a half dozen drugs that a paramedic might select from in order to take the next step in a resuscitation. And as we've gathered data and evidence, we've narrowed that down to a smaller number, 2 or 3 drugs that might be used in the emergency setting. That means that we can emphasize chest compressions, doing rescue shocks, good CPR that continues with some drugs administered on top, and really focus on the things that work to resuscitate a patient rather than having too many choices.
So the new guidelines, much like they focus on training of lay providers, also focus on high quality training for the healthcare professional. So what I mean by that is we've been using different techniques to train our healthcare professionals, using high fidelity mannequins that can breathe, that can have pulses, that can open and close their eyes, and incorporating those into resuscitation training. We know that healthcare providers don't work as single individuals, they work as parts of teams. The new guidelines recommend that they focus on that team training and learn to work together. You've all learned how to do CPR on a mannequin here. Healthcare providers are asked to do CPR, but asked to do CPR really, really well. The only way to know how you're performing is to actually look and say, what depth am I compressing at? How fast am I compressing? Am I still leaning on the chest, or am I completely letting go? And getting feedback on that to try to improve on your own performance.
The Heart Association has recommended that patients who've had a cardiac arrest have emergent evaluation of their heart for many years. But more and more data have pointed to the benefit of this for people surviving a cardiac arrest. And our new guidelines really make stronger emphasis on the rapid delivery of patients to a place where a cardiac cath could be performed, to do it when it's recognized that that's the diagnosis, and to consider it in patients where we're on the fence about whether that's actually the cause of their cardiac arrest.
Vivek, thanks so much for being here.
Thank you, Peter. You know, what I want people to remember today is that the strength of the chain of survival is only as strong as the weakest link. The strength of this chain relies on the early recognition of cardiac arrest and prompt interventions like effective chest compressions and early defibrillation. Without those first few steps, healthcare providers would have extraordinary difficulty in resuscitation.
That's everybody here.
Yes.
That's everybody watching us in America. Great big round of applause for you guys. Look at our volunteers down here. Terrific work. We're watching you at home. Give yourself a round of applause, too. And now, a few words from American Heart Association volunteer Elizabeth Rome.
Like many of you, heart disease has affected my family. I hope that you will take the time to learn CPR. Whether you're watching CPR in America, where the American Heart Association has made the learning of this life-saving skill very easy, or you go to heart.org, wherever you are, become part of a generation of lifesavers and learn CPR now.
All right, now you know. Yes. Now you know Hands-Only CPR. You can watch this program online and share it with your friends and your family. Go to our website, secondopinion-tv.org. Type in your zip code to find a CPR class in your area. You can also find all of our patient stories, information about CPR in schools, and links to other American Heart Association and Second Opinion resources. Thanks to our special guests who joined us here today. Thank you to our studio audience and our CPR class. And thanks for your help. Thank you, everybody. And thank you for being with us for Second Opinion CPR in America. I'm Dr. Peter Salgo. See you next time for another Second Opinion. Way to go, guys.
Second Opinion is brought to you by Blue Cross Blue Shield. Accepted in all 50 states. Blue Cross Blue Shield. Live fearless.
Second Opinion is produced in conjunction with UR Medicine, part of University of Rochester Medical Center, Rochester, New York.
CPR in America was produced in collaboration with the American Heart Association.